All right, we have quadriceps right now on the superficial front line. Again, we have a nice, interesting group here. We have rectus femoris, this beautiful fusiform muscle in the center that crosses over the knee and over the hip. There's our double crossover, as you've heard me say in class. Troublemakers. We don't like double jointed muscle crossovers. They cause trouble because they can never stay uniformly strong. So just this center one, we have vastus lateralis, vastus intermedius. There's or vastus medialis. Vastus intermedius is underneath this rectus femoris of the muscle, and then we also have sartorius coming down in here that acts as a fifth quadricep muscle. We're not going to talk much about that, but that also has a little bit of a play in that quadricep extension. That does cross over the hip with that rec fem. All right, so quadriceps. Let's click on this and look at these actions. So this is what you normally see with a quadricep. You see knee extension. You can see the hip point here from rectus femoris and then crossing over at the patella tendon. So the rec fem will create that nice stabilization at that hip point and then draw the lever up. Then we have just rectus femoris is not only knee extension, but we have hip flexion from rectus femoris. So if you notice that this muscle comes up and we have the lower leg in a nice position. Now, doing this movement, now the skeleton looks fantastic doing this. You can see the acetabulum moving really beautifully inside of that ball and socket joint. But realistically, when we have all this muscle connecting in, hamstring connecting into the pelvis, and gluteals connecting into the femur, and spinally rectors connecting into the pelvis, when that comes up that high, it's going to pull this pelvis down into a posterior tip. So we don't want to hip flex that high unless we really have the ability to do it. But then that's a whole nother animal of, you know, being a little hypermobile that I don't want to go into right now. But we want to really keep this movement into a really nice position so that it only moves from the joint and the pelvis doesn't move, just like it is right here, but not necessarily that high. This part of the shaft of the tibia is in a nice placement because it's going to give active firing to that patella end of the tendon, and I like that. So that's rectus femoris at hip flexion. And then, oh, look at what rectus femoris does when it's isolated and there's no movement at the knee. It will anteriorly tip the pelvis. So what does that remind you of? That reminds you of hip extensors of the spine, right? Giving that little anterior tip. Also iliacus, giving that little anterior tip. So, you know, we've got some nice coordination going with when we go into our quadricep lifts and I say stand up straight into spinally rectors. I'm not kidding. I want you to really create that balance between those muscles and get everything really engaged. Abdominal is long, spinally rectors active, rectus femoris posturally, keeping that body really nice and erect. Postural muscle, if I haven't said it yet, superficial, front line, but postural. Vastus lateralis is knee extender. There's your lateral quadricep. It also is a functional muscle. We'll get into it again later. Notice where it attaches to, the femur bone. It does not cross the hip. It is an extensor of the knee. It goes across the patella tendon and attaches to the tibia. Medialis, same thing. Attaches to the other side, interior part, medial part of the femur, and then goes down to the patella tendon on the inside of the knee. So there are, we don't go into intermedius on this, the shaft of the femur, but again, another extensor of the knee. So what can I tell you about quadriceps? I can tell you that if you look at that muscle, it looks pretty simple, but it is the most frustrating muscle that I have to work on. Why? Because it's right in front of your face and nobody seems to really look at it for more than it's worth. It has 14 trigger points to it. One of the most trigger pointed muscles on the body for its size. Intermedius is frustrating because I can't get to it because it's underneath rectus femoris. And rectus femoris being that postural muscle, when it gets weak, it gets tight. When vastus lateralis and vastus medialis get weak, they get long. So you end up with a thigh muscle that looks like a big strandy string down the center and then nothing going on to the sides of it. So strengthen, 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 strengthen. Lots of firing technique, lots of contraction. You can extend the knee till the sky turns green. And if you don't apply the contraction to the muscle, you're just using very, very minimal amount of muscle. So really give that muscle a good contraction. Don't be afraid to sit and extend that knee. You will reciprocally inhibit the length of the hamstring at the knee point. Very good. So with that, we're going to move on.
All right, so we are doing quadriceps, which are very, very complex group of muscles because they are considered the longest, strongest muscle in the body. Here is the main quadricep muscle, rectus femoris, which is your postural muscle. And then we have vastus medialis in the inside, lateralis on the outside, and then underneath, there's intermedius. So those four make up the quadriceps. Now, sartorius is known to be the fifth quadricep, attaching to the same site with tensor fasciae lati as rectus femoris, which is called the tri-attachment point. So, knowing this, rectus femoris being postural, vastus medialis, vastus lateralis being phasic, we can now start to say with our training that we need to, during a concentrated extension, slow it down with a load, and that rectus femoris is going to be okay. And then the outer and inner parts of the quads, we can do a little bit more repetition, lighter weight, a little bit more speed. They're your walking muscles. They are really lovely and active during a wide stance squat, as you saw in that video that I did putting it all together. So we have a few different things going on, which is why it gets complicated. So when I see problems in rectus femoris, more than likely it's an inflexibility due to weakness. And what's the first thing people do? They say, I started stretching. And I will tell you from experience that stretching a muscle that's weak will not do you any good because it's inflexible because of its weakness. So in order to get it more flexible, you need to get it stronger. So in the video, you'll see a very simple way to start to strengthen rectus femoris. And then I also have a new section for weight training in the gym to do some explanation if you can't afford a personal trainer and you want to learn a little bit more about gym equipment. It gives you some how to look at your gym equipment in the facility that you go to a little bit differently. So check that out as well. So removing this, I'm going to just go through a couple little things. Now, intermedius is your, oops, there it goes. Bye-bye. All right, intermedius is your going down the stairs in pain muscle. It's very difficult to palpate. It's very difficult for me to get to, and therefore it's going to be very difficult to start to try to manually release it. So you really want to keep vastus or rectus femoris, that big quadricep muscle, strong. When this muscle gets strained, and I will tell you, I just strained mine very gently by carrying a table over my head down my hill to my workshop. Don't ask me why I did it, but I did it. And the load that I had was okay for me in every respect except my vastus intermedius was gently overused. So I felt it for a few days and I knew exactly what I had done. So the point of that is that, nobody is perfect. We all do things without thinking sometimes, as far as the repercussions due to the fact that we are in shape. And you need to think on a muscular level when you have issues. I knew it wasn't my knee because I had done something that gave me muscular contraction. I walked down there, I walked down a hill. I now know from what I do that that muscle, vastus intermedius, is going to be my working muscle for that movement. So when I had that trigger point show up, I immediately knew what it was from. And that's what I'm trying to give to you with this. So when you do things like that, maybe you start walking and then you change your pattern and now you're walking down a hill and you start picking up your pace. That's the things that you're going to notice. Um, this is vastus medialis and it's on the outside, and you can see it works with a quadricep extension. And if you rotate a little bit outward, you're going to get even more on this. So it's a interesting muscle. Here is, they call the whole group quadriceps femoris, by the way. Here, there's rectus femoris working in a leg extension, and vastus lateralis. They're going to show you the leg extension on. I actually show you with a little bit of rotation at the hip on these, the way that that you can work them, but they're all worked with a knee extension. All right, and then we're not going to go there. So if we put a few of these layers back, there's lateralis. Now what I want to say about lateralis is when the hip becomes off balance and loaded to the right, and this section of the attachment site becomes short and strong and draws the top of the femur bone and the pelvis into a more flexed position, this part of the pelvis is going to shift and move a little bit more forward. You're going to have a rotation, and on the left side, the lateralis muscle is going to start to get the shift because now the center body weight is shifted to the right and lateralis is actually becoming a little postural. So I will find a lot of adhesion in this part of the muscle, and people will complain about hip pain, thigh pain. I hear a lot of my IT band is bothering me. Now I'm going to show you something about this muscle, and you'll see it in the trigger points. Well, look at where this muscle is. The IT runs right over the top of it and attaches the glutes to it. So, and you'll see when you get to the trigger points, there are a quite a few trigger points in this muscle, and they will mimic that type of feeling. Very rarely do I find the iliotibial band to have any trigger points in it. And if they do, they're so specific, like you would have to press on them to activate them. They may get activated from this muscle, but the tract itself, if it starts to get tight, it's more than likely because the muscles around it are getting weak or they're getting posturally dysfunctional. So, in order to correct vastus lateralis from getting that postural adhesion, you need to correct the hip. So, you need to go back to that unloading the right hip in that first series that I did with the shower reset and get those hips back in order. And if you're not practicing that shower reset every day, you're missing out because it's fantastic. It's really fantastic. So with that said, let's bring it back to the center and we'll add rectus femoris. And you can see this muscle comes up right to the top. So this is going to be postural. Now imagine you let your rectus femoris, your big, mean postural quadricep, get weak, and now it gets tight. Here's where it's attached to the patella tendon, and then it's up top to the front of the hip bone. Those two are going to pull together, and what's that going to do? It's going to pull on the kneecap, and it's going to pull the hip forward, which is going to stress out your back. It's going to stress out the opposite side of the hip. It's going to stress out the knee. It's probably going to shorten up your uh, inner thigh muscles. It could strain the opposite side. I mean, there's a lot that's going to go on, and those are just a few things. Once your therapist gets in and starts palpating all those things, they're going to find all kinds of goodies that they're going to be able to work with, and they're going to start creating this peeling effect where they start to release things and start to work into what the real problem is. And they're more than likely going to start to find out that it's all going to start in that front right hip. So, with that said, don't worry about flexibility on this right now. Worry about strengthening it. All right, so we're going to move forward. All right, so here's the trigger points. Rectus femoris, right where my cursor is. So here's your trigger point for rectus femoris. Look at this. Look at this. Here it is by the hip, and look at where it radiates. Oh my goodness. Look, it's at your knee, and look at where the trigger point is. Anybody who's worked with me knows I'm on this attachment all the time. And why? Because this area is so abused. And look at where it radiates. Oh, I have knee pain. Oh, Jen, why are you pressing up top there? Okay, now you know. So now you know all my secrets. All right. Vastus medialis. It's got two trigger points inside the knee, inside the by the inner thigh. So if you're doing an inner thigh movement, you may get this muscle included in it. When you start to move upward, you may hear a little screech out of your client. Or if you're working on yourself, this area tends to be a little bit more sensitive because of, what it holds. If you look at this realistically, there's a lot going on in this area of this inguinal area of the leg. There's a lot of nerve. There's a lot of blood venous work going on in here. So the body's going to protect this, and you're not going to enjoy somebody working here as much as you might on your back hamstrings. So it's important, but it's also important to, if you're working with a therapist, it's important to communicate with them on this because you do not want them to send you into a stress response. If they start to work too hard, ouch them, tell them that hurts. It shouldn't hurt. It may seem like you can take it, but don't take it. All they need to do is lighten up a little bit, warm back up, move away from it, and then move back into it. And normally that'll be enough for you to be able to feel good with the therapy. If it continues to hurt, they have to walk away from it. You can't keep hurting somebody and expect the body not to go into stress response. And it's going to send out cortisol. It's going to send out the triggers into the tendons, and eventually it'll start to build up that stress response of the sodium, potassium, and then the elevation of calcium, magnesium. And that's not a good thing on a long-term basis. So communicate. Do not hesitate to tell somebody they are working too hard, and nobody should be bruising you. And this is a lot of you will get bruises in this area. That means that there was not enough warm up and they went too fast, too hard, too deep, and that that's a stress response to the body giving you a physical stress response that you've got a bruise. So there are your knee pain, inside knee pain, and patellar tendon knee pain. So there's medialis rec fem. Let's go to, no, let's go to intermedius first. So intermedius is right underneath the trigger point for rec fem, and now you're looking at quadricep pain. So as a therapist, you're not going to get to this very easily without trying to move a little deeper. This muscle is attached to the femur bone, so it's going to be really, really sensitive to get to. So you'll be better off really warming up rectus femoris and trying to gently nudge this trigger point by getting rectus femoris into a nice soft position and not digging in too deep, too fast, maybe doing some off the table work and some forearm myofascial work, and trying to just do a gentle compression with the forearm. Of course, we're never doing anything with our elbows. We know that, right? Because right at the tip of the elbow, there is no ability to be able to feel. So no one should be using that elbow point because you cannot feel with that. So forearms only. Make sure that that forearm is flat. Make sure there's lots of warm up. No stress responses on these muscles, please. And then lateralis. Oh, this is like one of the most beautiful muscles because it gives me so much validation when people say I have IT band pain. So your IT band is running right along here, and look at the trigger points on this muscle. Look at them. There's 9 right here. These 4 right here. Look at them. They're the back of the hamstring area, side of the knee area. These 4. Look, running right up and down. What does that look like? It's going to be because when this muscle is overworked, normally the pelvis, I find, is tucked under, and when the pelvis is tucked under, we're going to have a lot of stress on the piriformis, and the piriformis is probably going to be active, and you're going to see hip pain, and now you have hip pain, and you have this pain running down the leg, and you have it running down here because the whole muscle has probably got issues in the back of the knee, and so you're going to have that pseudo sciatica, and it's not sciatica at all. It's pseudo sciatica, and it's all from this beautiful nemesis. And then this top one up here, right by that top of that femur bone, close to that joint. And we have another one going down, looking like it's almost traveling down hamstring on this backside. So you put all of these together and you have a lot of pain. And I will let you know that I work on this a lot right here, a lot on the left side, a lot. It is always congested, it is always overused, and there's always trigger points in it. So correct that right hip, get the load off of that right hip, and get the left leg to do less of uh, the lateral correction, and you will see this muscle start to build nicely with strength. You'll see this pelvis start to neutralize in its flexed position. You'll see the piriformis come back to normal. You'll see the lower back start to become balanced again, and you will have a very happy client. And that is your goal. Everybody's goal is to have a happy client. And if you're a client listening right now, you know now what I am always working on. I think of every one of these muscles during your session. They are going through my brain, attachment site to attachment site, making sure that I try to keep a balanced body for you. However, life is life. And if you see me weekly, biweekly, or monthly, you know that there's lots of time in between there. And that's why I'm trying to give these videos out to you so that you can do these self-helps and keep proactive so that it makes it even better when you come in because I can get more done. And the more I can get done, the better you're going to feel and the more that you're going to be able to do during the week. So there's quadriceps. It is a very lovely, longest, strongest muscle on the body. And Hope you enjoyed this.
So today we're going to talk about quadriceps. I'm going to try to brush through this very simply. I'm not going to get super complicated. There's 4 main quadriceps. The center one is postural, rectus femoris, and then the outer and the inner are mostly phasic, and then the one down the center underneath rectus femoris is mainly phasic. It may have both positions on that. So the first thing we're going to do is understand how to see if you may have problems with your quadriceps. All right, so all you have to do is get to the edge of a bed, and you're going to take, and be careful doing this, because if you have structure in there that's off balance, you're really tight, you could strain yourself a little bit. So try to get something a little lower so that you can make sure that your foot doesn't just hang off of the side of the table or the bed. All right, so the first one we're going to do is rectus femoris, and that attachment site is right at the front of the hip point. And we're going to take the leg and we're going to move it down off the side of the bed or the table. While you're doing this, you can put your hand underneath your back for some support. Now, if your leg can comfortably drop like this, then rectus femoris really is generally okay. If your leg can't come beyond this point, then we have some issues to deal with at that attachment site to the hip. Now, to do the vastus group, intermedius, and the medialis and lateralis, you can bring this leg straight, bring this knee up, and try to pull the heel towards the glute. Now, if you can't get your heel all the way to the glute, that means you have structure on the outer part of the quadricep that's going to need a little bit of work done. Now, the reason why you have your leg up like this is so that we take rectus femoris out of the actual stretch, but this movement is a little hard to get the heel all the way in on me, but I'm very tight into my quadriceps because I stand a lot during the day. So I do work on that as much as I can. But if that is the case for you as well, and you have a little bit of room in there, then we know that we have loaded our phasic muscle groups, and what we have to do is now strengthen the center rectus femoris, which we're going to do next. All right, so I'm going to show you how to do an easy at-home quadricep exercise. We're going to focus on rectus femoris to start, postural muscle. So I'm going to put in the link where you can pick up something like this. These have each individual section has a weight in it, and I believe this is about 6 pounds. So it's an easy way for you to start to progress with some quadricep strength. My suggestion, if you haven't been doing quadricep work ever or in a really long time, take them all out and just leave one in. And then every 2 weeks, once you can get to 15 repetitions, one set of 15 repetitions 3 times a week without any burning sensation caused by lactic acid, then you can put a second one in. But wait until you get to that point. We don't want to start overworking a muscle. And even though this is a quadricep exercise, eventually these are all going to start getting put together, but I want to teach you independently. Now, I chose this because this is an exercise that people can do in a seated position and start to focus on quadriceps, but there are a lot of different quadricep exercises. Some of them have a lot of synergists involved though, and this one happens to be one that will really hone in on that rectus femoris. I'm going to show you the first direction, and then we'll move the legs outwards to try to get into that vastus group, and then we will work on our speed and a weight adjustment. All right, so once you have your weights onto your ankles, you're going to find some place that you're comfortable. I have my feet on the floor. You're going to want to have a little bit of weight on the floor. And the reason being is because there's weight on your ankles now, and we don't want to draw down on the ankle or the knee with weight on it. If you're not strong, it can trigger off tendon trigger points. If you have very weak muscle at the knee, it can actually even start to stretch out ligament. That's going to a little bit more severity, but I always start on the side of caution. So you're going to sit yourself into a nice upright position. A chair would be great because then you can really focus on making sure that you have a nice position of your upper body. Hands can be by your side, and then you're going to take your right foot and flex it toes to the shin. That's called dorsiflexion. And we're going to extend and try to straighten the knee out, and then point, and then bring it back down. Now this is done in a 2 count, flexing, 1, stop, point, 1, stop. Right side, flex, 1, stop, point, 1, stop. Left side, flex, 1, stop, point, 1, stop. Now we're doing one at a side, so you'll be doing up to 15 total, which would be a count of 1, 1, 2, 2, 3, 3, like that. So you're going to do that straight muscle, 15 repetitions maximum, 2 counts up, 2 counts down to keep it slow, and to load this muscle with a little bit of weight since it's postural. If you cannot get to 15 repetitions, then you go to the point where you start to notice that you're not keeping a body position properly. For example, if I start to come up and I lean forward into it, or if I have to use my body to pull the leg up, those are deviations. We want isolation and we want to keep that hip strong. The second thing is if you feel pain someplace at the hip point or the lower back, chances are you're not in the right body position and you're straining. So as you come up, the only thing you may feel at the beginning is the hamstring at the back of the knee site, or up towards, moving towards the mid-sides, the middle of the thigh, because it's in a short position. Hamstrings is also postural. So now we have the law of reciprocal inhibition working. As we squeeze this muscle, the hamstring cannot contract. So it's going to elongate, and this is one of the ways I love actively stretching. If you do your strength training exercises without fault and really put that time into them, they will create better flexibility than you could ever do in a passive stretch. And the only thing you're going to need to do at the very end would just be to finish by taking a few passive stretches at the very end to try to bring anything that might not be back to resting length back there. Never stretch before your workout because your muscles are cold and they need blood flow to be able to warm up first. You can do your warm up, and that's what that body reset does. Moving through those 8 exercises before you start is really a great warm up. So now if you're sitting in a chair and you can lean yourself back into the chair a little bit, we can do both legs at the same time. If you're sitting where I am and you don't have a seat back, then be careful, because this is going to start to get the symmetry, the synergy of that deeper core involved, because now I have to stabilize with my upper body as I lift my lower body. So only do these if you have a chair back at the beginning. Now the second exercise, we're going to take the legs a little bit wider. If you have weights in your ankle cuffs, this is where you would either take the ankle cuffs off or take a weight out. So what does that mean? It means probably take the ankle cuffs off, unless you want to have a second pair of ankle cuffs around, which to me is just like, okay, yeah, sure. But that's kind of unrealistic for most people. So we're going to take the ankle cuffs off. They're way easier to get off than on. All right, and now we're in a little bit of a straddled position, and we're going to focus on vastus lateralis. And it's going to be 1, 1, 1, 1, 1, Good. And this is, again, you can go to 15 with these. You're going to feel the hamstring again, but you're going to feel it in a different area. You're going to feel more towards the outside of that hamstring working. And again, if you're in a chair, you can lean back and do both together. And there's like a little toy that used to do this years ago. And you would press something and both the legs would go up at the same time. All right, and that's the outer quadricep. Now, if you have, a lot of ladies, as they start getting older and their hip joint changes, they'll start to rotate their legs in. So those outer quadricep exercises are going to be absolutely fantastic for you, especially helping you strengthen and get some flexibility at those knee attachment sites. But there's a lot of people that come in and their feet kind of like flop out to the side because they're tight on their outer part of the hip and they're long on the inside part of the pelvis. Now, I'm not going to do an extension, but you can sit here and you can practice just bringing your knees together to help to open up that outer part of that thigh. And we'll do some of that series, but while you're in this position, don't do those wide exercises, but instead, after you're done with your knee extensions, just go into some simple, this is gluteal active stretching. So we're squeezing the internal part of the pelvis and we're going to stretch the outer part of the pelvis. So that's that leg extension. All right, so we're going to do a pin and stretch for quadricep. So I have a bolster underneath me right now. You don't want to use anything too hard because there's too many trigger points in there. This is a little soft, but I didn't have anything that was within reason. So I would say a softer, long, something that might be just a little bit more rigid than this, but the same size. But this is okay. I mean, it's giving me a little bit. So you're going to come down onto your stomach, and I have my bolster right underneath my hip point. So it's right here at the crease of my hip. And what I'm going to do is I'm just going to take both of my legs up and I'm going to squeeze my glutes and release my glutes. And what this does is it creates reciprocal inhibition. And so when I squeeze my glute, the front attachment site to the quadricep group cannot contract. And so it's going to gently open up. And what the bolster or the roller would do is pin it so that I get the muscle below it to open a little bit more than the tendon. And then we're going to move down and move the bolster midpoint right at the quadricep. You can come all the way down, and we're going to do a heel kick with this. And 1 foot at a time is going to kick up. And what that'll do is it'll get that quadricep to start to lengthen with the pin at the center or the belly of rectus femoris, that postural muscle. And we can do both together, flexing the feet to the floor, squeezing and pushing gently into that, and then pointing. And there's your big stretch. Flex, push, squeeze, point, and release. Flex, push, squeeze. There's your squeeze for the muscle. To contract it, there's your relax, and there's your stretch. Good. And then the last part of rectus femoris is right above the knee. Now, if you find you have really tight center quadriceps, rectus femoris, you can do 4, do 2 to the belly, go down just a few inches below the hip, and then a little bit above the knee, right between where we are now and where that center is. You can do as many spots as you want. So the first one you can do is just warm up the knee, pointing the foot, and just doing a little heel kick, just to get some blood flow in there. And then once you feel that nice warmth go in, so we're gonna flex the feet, contract into quadricep, point and relax, and then point and bend. And that's your leg extension. Flex, push, squeeze, point, and bend. So we've got leg curl, hamstrings working, opening up the quadricep, and then leg extension, squeezing the quadricep, relaxing the quadricep, and stretching it. And there you go. You're gonna just do rectus femoris because that's the postural muscle. Very good.